Hello. Just give me a moment to get started. I'm making sure all of the technology is set up, and I'll be right there in a moment. Here we are. Perfect. Hello. Hi. I'm Dr. Elizabeth Hughes, and I'm glad you're here. Now, if you are watching this video, it means one of two things. Either you have made a time to talk with me, and in which case, thank you for watching this video, and I'm looking forward to getting to know you. Or you're watching because you are frustrated with what's going on with your health, what's going on in your life, and you've reached a point where you are looking for something different. And in that case, you're in the right place. So thank you for being here and welcome. This video is going to go over some of the common questions I get about what my background is, who I am, how can what I do help you? How is it different from regular medicine? Why have you been so frustrated for so long? Why does it get to the point where it seems like nothing's working? Why don't other doctors do this? And so all of these questions are going to be answered today in this video so that when we speak, we can talk about you. We don't have to spend time talking about all of this background stuff. All right, so let me explain a little bit about my background. I am, at my core, a dermatologist. I'm a board certified dermatologist, and I did practice conventional medicine for 25 or so years. But I have moved far beyond that into a realm of restoring wellness, moving beyond what regular medicine can offer. Uh, and that is because I realized that regular medicine has some incredible blind spots about what it takes for real wellness to happen, real health. And I want to explain that journey that I went through to become who I am now and do what it is that I do now. So, as I said, for about 10, 12 years, I was a completely conventional doctor, meaning I was actually a professor and a clinical on the clinical faculty at Stanford. I was the stereotypical, white coated doctor where I believed that everything that could be known was written in medical textbooks, or you could find it in journals, and that there were things that if there were questions out there, science could answer it. But as I practiced more and more, as I treated more and more patients, I realized there was a problem with that idea that medicine actually did not have all the answers. Medicine could not explain why some people with a supposedly fatal condition or a lifelong condition, why some people could heal, why some people could live a normal, healthy life with a supposedly chronic debilitating condition. Why some people after, let's say, a stroke or a horrible accident could walk out the door of the hospital, whereas 90% of others would not. Those inconsistencies that is frankly not scientific, they started to bother me. They started to bother me, and I started to wonder, wait, there's got to be something more than these statistics. Got to be some other answer. Now, around this same time, I also started to really listen to what patients frequently told me. And I picked up on some patterns of things they told me, like, I'm too old to get well. I've had this condition for too long. Everybody else in my family has this condition. I can't expect any better. I need to just learn to live with it. My doctors tell me it's chronic and there is no cure. And things along those lines. And I started to really think, because I was starting to really question whether or not conventional medicine had all the answers. And I started to listen to what people were saying and what people had been told by other doctors, my own colleagues, things like, that's not curable, you're too old. And I realized that biologically, these are not facts. Biologically, these are not true. All of these are not facts, they're more like opinions. Thing and I something sort of clicked in me. And when I heard people say things like, I'm too old, I'll never heal, well, I would challenge that when I had time. The pressures of a medical practice, I might talk about that in a few minutes. But when I had time and I was able to talk to a patient about beliefs like, well, this is supposed to be a lifelong condition, I would say, well, no, it's not. Your body can heal. Or, I'm too old. Well, no, you still heal. And what I noticed was that people started to have extraordinary results. And when I say extraordinary, I mean outside of the ordinary range, outside of those statistics that people are, stuck with. 80% of people have this outcome. People started to have those extraordinary results, so that skin cleared up, wounds healed. And I am lucky that I'm a dermatologist, because the skin's very accessible. You don't have to do any poking or probing or blood test in order to see whether or not your treatment's working. And the skin heals quickly, so you can see the results of anything you do, whether it's a medication, or whether it's a change of belief or attitude, or a new idea that comes in. You can see the difference in skin. And I think that's one of the reasons I was uniquely poised to make this connection, is because I was dealing with the skin that is so easy to see when you change things. So these ideas, this medicine's missing something, and people are believing opinions and thinking they're fact, sort of rattled around in me. And I started to become less and less comfortable with the way I was practicing medicine. And I knew there was something else I needed to do, but I didn't know what. So I dove into what you might say is the science of healing. Let's call it that. And I was willing to approach it from any angle possible. It didn't have to be just what's in our research. You know, got a health coaching certification. I got a yoga, I studied yogic philosophy and Ayurveda, and I got a yoga teaching certificate. And I studied with a shaman, and I learned energy medicine techniques, and I experienced energy medicine techniques for myself. And I realized that there is a completely different science of how the body gets better that is not captured in conventional medicine. That there is that focusing on illness, which is what we all do. I have, a disease like I have asthma, so I need to see an asthma specialist. That is only going to reinforce your illness. That to actually have health, to actually have well-being, the focus has to be somewhere else. And that when you put your focus, when you escape from the opinions that are being passed off as fact, when you escape from those, you actually have a completely different experience of well-being. And that's what everybody wants. I often think, I don't necessarily for myself care whether or not I have a diagnosis. There are lots of people who can have a diagnosis but have a very different experience. And you see this in people with autoimmune conditions or degenerative disorders all the time. There are some people who just go, 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 despite their diagnoses. They don't allow their diagnosis to be the prognosis. They don't allow the average expectations for health be something that they believe. They move beyond that. They move into a new, more extraordinary outcome. And this is where medicine needs to focus. This is what we need. We do not need more emphasis on illness. And you particularly do not need more emphasis on your illness. What you need is more emphasis on health. And you need to know how health is created, not how illness happens. And what I will say, in medical school, we don't learn how health is created. We do not learn it. We spend a little bit of time, probably, in my medical training career, less than 1/8 of the time was on how the body was put together when it's healthy, but nothing about the technologies of wellness. Nothing about that. And the technologies of wellness look completely different than the illness-focused medicine we have right now. All right, let me just see. So, why don't other doctors know this? Well, or why can't, why doesn't you might say, well, this just applies to regular conventional allopathic medicine, but it actually is a focus that exists, I've discovered, through naturopaths and acupuncturists, and most people practicing medicine have an illness focus, not a wellness focus. And they are focused on technologies that are illness driven. Let's put it that way. Illness driven, a medication for an illness and that reinforces the illness. And I want to say this really, I'm going to say this now, and I'm going to repeat it in a second. You cannot get the health you want by focusing on illness. And seeing an expert in illness is only going to reinforce illness. So when people ask me, are you an expert in, intestinal flora? Are you an expert in cluster headaches? Are you an expert in hypothyroidism? Are you an expert in multiple sclerosis? And I say no. And that's because you don't want an expert in your illness, because the expert in your illness is unaware of, has a big blind spot to the technologies of health and wellness, to the potential for health and well-being that you have within you all the time. Because focusing on illness will only reinforce illness. And this is why regular medicine can't give you the results that you want. And I will say this as a board certified dermatologist, have I ever cured someone of psoriasis or eczema as a dermatologist? No. I've gotten them hooked on medications they have to use for life, some of them extraordinarily expensive medications. But have I cured people of psoriasis? Have I helped them move beyond the average results that people get by being a wellness specialist, using these technologies of wellness? Absolutely. Absolutely. Yes, without a doubt. The difference is night and day in terms of the actual outcome and the actual lived experience that a person has. When you stop accepting the diagnosis as your prognosis, when you get rid of those opinions and stories about how your health is supposed to go, and you focus on your wellness and you focus on what you want to get, the change within your body and the change within you is extraordinary, is extraordinary. And so you don't have to worry about a quote unquote cure that might come from a pill or a procedure. That's no longer your focus. Your focus is your wellness, your vitality, your well being. And that's how I differ from a regular doctor. And why you won't get it is because other medical practitioners are illness focused and are going to spend time working on your illness. So when people come to me, they'll say, well, are you going to, uh, you know, run some tests? Are you going to prescribe medicines? Are you going to, give me a diet, supplements or something? I was like, no, no, no. Those are all illness focused interventions, procedures. Those are illness focused. The way that we work together is totally and completely different. It does not focus on illness. It focuses on the stories and the opinions that you may have been told by lots and lots of well-meaning people about your health and your illness, and focusing in on what is true and what you want to have happen, and then using those technologies of wellness to actually bring them into your body. Because when you are freed of all of that belief that goes along with having a diagnosis like chronic fatigue syndrome, or you're freed of the outcomes that your doctors have told you, or you're freed of the idea that I'll have to take medicine forever, or you're freed from any of that story, your life actually gets better. Your life gets better, and you can start to function with a freedom and a liberation from all of that that mental junk that has been actually physically holding your body back. And you'll ask, okay, so what's the evidence on this? What's the evidence? And all I have to say is the evidence is enormous, incredible. There is evidence that what you think about your health, even simple rating scales, just rating yourself on a 1 to 5 scale, 5 being excellent health, 1 being poor health, will determine things like whether or not you'll get the common cold, whether or not you'll have complications after surgery, your likelihood of developing a chronic cardiac illness. This has been tested and studied over and over and over again. And this is where the future of medicine should go. The future of medicine should be going to changing what I call your health set point, what the set of beliefs that you have around your health, what the stories you are that you carry about whatever diagnosis you have. This is where actual freedom from illness occurs, when you realize that illness cannot limit you and that you have the power to change that. Now, here's where I will say, here's where I may lapse into a little bit of conspiracy theory sounding, but think about this as a whistleblower. Think about this as someone who's been on the inside. One of the other reasons that conventional medicine doesn't consider these technologies of wellness at all is that your health is not controlled by your doctor. And it's not really controlled by medical schools or anything like that. Your health is controlled by pharmaceutical companies that make the available treatments, and your health insurance companies. Now, this is especially true in the United States, where we have private health insurance, but in any place where there is someone who is paying for your health care that's not you, those are the forces that are controlling your health. And especially pharmaceutical companies have no incentive to create cures. And I want you to think about this. Pharmaceutical companies are for-profit organizations. And if they could create a pill that, let's say, cures high blood pressure, they're high blood pressure medications, it's billions of dollars a year, and billions of dollars a year every year. And people get told, well, once you're on a high blood pressure medicine, you're going to need to be on it forever. And, you'll probably need some more, and we'll probably have to change it or adjust the dose. If I'm a pharmaceutical manufacturer, I'm like, bingo, I got a customer for life. And that person will pay me for years for this. So the pharmaceutical companies desire to cure, their incentive to cure things, especially common illnesses, especially common chronic illnesses. Chronic is the worst word in medicine. Especially common chronic illnesses is zero. They lose customers. They lose revenue year over year. And insurance companies as well. Insurance companies' goal is to make sure that you get the minimal amount of care that you need to stay alive, but they actually don't have an incentive to make you 100% well. Because if you were 100% well, you might look at your insurance bill every month and say, why am I paying this much? Like you would stop paying you'd stop paying copays, you'd stop paying for treatments, and your insurance company all of a sudden kind of loses out. So unfortunately, we're all trapped in a system that reinforces illness. And that if you want the extraordinary results, if you want to be that person who, the 1 out of 10 who has a different result, or the 1 out of 20 who has a different health result, it requires stepping outside the health system, which is why people will often ask, do I take insurance? And the answer is no. Insurance thinks that what I'm doing is pointless. But remember, they've got motivation to keep you ill. They've got motivation to keep you hooked on medication and hooked on paying premiums and hooked on seeing doctors. And that's not what you want, right? That's not what you want. And that's not what I want for you either. And again, when you escape from that system and from those opinions that aren't actually facts, you get freedom, not just in your body, not just in your life, but you get freedom from all of that, that other system about, medicine keeping a hold on you, a hold on your health, and your wellness and your well-being, right? Okay, let me just tuck and make sure. All right. Let me give a really brief moment about how how I want to talk a little bit about the technologies of wellness that I was talking about a second ago, and then how working with me works specifically. So I alluded to this a little bit earlier, but what I wanted to say very specifically is your body is always attempting to repair itself. If you've ever said, I'm falling apart, well, if you were actually falling apart, you'd be dead in 6 weeks, because nobody can survive longer than 6 weeks. After 6 weeks, you have no skin, no intestinal lining, no platelets, no immune system, no lining to your lungs. You'd be dead, right? And lots of other cells would be gone. So we are not actually falling apart. We are always, always, always rebuilding and repairing ourselves. But depending on whether or not the body is sensing threat, whether you're sensing threat, and that threat might come from some of those beliefs like, if I'm old, I'm never going to get better. Well, that's a fear response. I'm just going to have to get used to this, even though I don't feel well. That is a defeat response, right? It's how we feel, it's what we believe and how we feel actually changes our biochemistry, because all of our thoughts and all of our emotions are expressed as neurotransmitters and hormones in our body. And those neurotransmitters and hormones directly tell our individual cells how to function. That it's as simple as that. It really is as simple as that. It's simple and yet so unfamiliar that it seems like it's crazy. But on a biological cellular level, this is how we function. This is it. And so this is why it works. Now, many people will come to me and say, so how do we work together? Like, are you going to use, are you going to use tapping? Are you going to use NLP? Are you going to use EMDR? And we'll be very, very focused on a specific technique, as if a technique is the key to your wellness. Now, speaking as someone who does a lot of surgery, right? Asking questions like that is a little bit like, or asking, like, I only want to do NLP is a little bit like asking me to remove a skin cancer only using a scalpel. Like, and I'd be like, I can't remove a skin cancer only with a scalpel. I need forceps. I need clamps. I need retractors. I need a needle driver. I need gauze. I need, et cetera, et cetera. I need other things. So focus on technique will actually not help you. There are a variety of ways we will work together, and we may use something that you're familiar with, but most of this is something that most of the way we will work together will be tuned for exactly what you need, because I have the tools to use when you need it. The same way sometimes you need a scalpel and sometimes you need stitches and sutures, right? That's just how it is. So I caution you, no matter what you decide in the future, to be careful of being technique focused, because technique does not, technique in the, without a context, let's say, and technique, or, one technique alone cannot cure you. Just the same way, just a scalpel or just one pill is never going to give you health and wellness, right? And what we're going for is your health and wellness. And that's what you want to keep in mind. All right, let me take a look and make sure. Okay. So let's talk about cost investment for a moment right now. As I've said, insurance does not cover this procedure. This is also, I should say, when we work together, it is not like regular medicine. Typically, when you go see a doctor or even a therapist, you will have, like 10 minutes with a doctor and save up, and it's 10 minutes every month, or, every, or even if it's an hour a week, you save up your concerns for a short period of time. And you are used to compartmentalizing your health into a certain period of time during your week or month. That is not how this works. This is an investment of your time and energy, and that is that's something that is not, you cannot be skipped. Because you are actually going to be rewiring how your thoughts work, getting rid of all of that mental junk, all of those opinions you've been leaving were facts, and resetting your nervous and neurohormonal system, your nervous system and your hormonal system. And that isn't something you can do just a few hours a day or a few hours a week. This is a process that can be all encompassing. So if you are looking for something that feels like a really quick fix, or something that you can fit in at 12:30 on Thursday afternoon, this is not a procedure. This is not a process for you. This process requires a significant commitment of time and energy. Now, it is not hard by any means. but it is something that requires some dedication. And I think about it as, technically running a marathon isn't hard. It's just put one foot in front of the other until you reach the finish line. So technically it's incredibly easy to describe what to do. It's just making sure that you finish it. And that's where I come in. I am the person running alongside of you as you go on this journey to reset your body for health. That's what it is. So none of it's hard. It just requires dedication, and it just requires a willingness to be present to the process on a day-to-day, hour-to-hour basis, and not necessarily while you sleep, and you are allowed, but it is a completely different process than typical medicine. So you cannot look at this in terms of how many sessions or how many hours or anything like that. When you're thinking about what we're going to do, if you choose to work with me, I will talk you through what the process looks like, but we can be in contact on a far more regular basis than you typically have with a doctor. This is dramatically different experience than anything you've had with your health before. It's a little bit closer to an intensive workshop than it is to a regular doctor's visit, if you must know, if you want a quick comparison. And so what about the investment of money in this? Is it expensive? And the answer to that, if you look in just terms of money, is yes. Yes, it is. But no, it's not. Because the benefits are far, far exceeding anything you've ever experienced before. When you think about what you've invested for medicine before, if you were to think about it in sort of black and white spreadsheet terms, your return on investment has been incredibly low. You are accustomed to paying money toward a doctor, toward a supplement, toward a medicine, toward an expert, and getting very little in return for that. This is what we're conditioned to do. I think about it as being nickeled and dimed to death. Best medical treatment, and you still get ill, more and more sick. And you might think about this as you were thinking about all the experts you've seen. Have they made you feel better? How much money have you spent? Has it actually made you feel better? And the answer, you can pause here and add it all up if you want to, but the answer, if you're watching this, is no. No, it hasn't made you feel better at all. But health in general has cultivated an idea of very low expectations for what you will get from any individual healthcare expenditure, healthcare encounter, whatever you want. You are used to not getting even close to what you put in terms of what you want in terms of health. So when you, as an investment in you, as an investment in your well-being, as this is the cheapest thing, the biggest bargain you will ever have. And not only because we don't have to see each other forever. We don't have to see each other forever. You're not going to be hooked on medication forever. Once you have freed yourself from those beliefs, and once you've reset your neurohormonal system, you're free. And not only that, you will notice, changes in other areas of your life. And I'll describe a client that I've worked with in just a moment and tell you about that. So yes, there is an investment to make. And no, it is not like any other investment that you've made, because previously you've basically lost money on your investments. Even if you looked at the greatest expert, if you're here listening to me right now, it means you did not actually get what you needed from the bigwig at Mayo Clinic or whatever it is, because that person is reinforcing illness, and you need a different technology. You need a different system. You need to focus on your health and wellness in an entirely different way. So it's kind of like looking at apples and oranges for, you know, trying to compare what I do with conventional medicine. They're not the same by any means. By any means. Actually, more like, oranges and automobiles. Sort of like they're not the same at all. So yes, let me give you a quick example of what happened to a woman when she worked with me, and you probably will be able to relate to this. And this is a woman in her mid 40s, and she had been ill for 10 years before she saw me. She started with a autoimmune neurologic condition for which she was hospitalized. She was actually partially paralyzed for a time and was in the hospital for an extended period. And even though she recovered, she still had some weakness of part of her body. And then that was only the beginning. Even though that she had recovered, she had gradually developed asthma, which she didn't have as a child. She developed as an adult, which is not common. She developed a host of food allergies and intolerances. She developed SIBO, small intestinal bacterial overgrowth, which did not help her intestinal problems. And she developed chronic fatigue syndrome. And the chronic fatigue had progressed to the point where sometimes all she could do was get up and brush her teeth in a day. Now, she had not gone without medical treatment. She had seen many, many doctors and practitioners. And when she started to work with me, she had a general medical doctor, a regular doctor. She had an immunologist, allergist and immunologist. She had a pulmonologist for her lungs. She still had a neurologist for the neurologic condition. She had a gastroenterologist, and she had a naturopath, and she was seeing that naturopath every week. She'd been seeing the naturopath every week for a very long time. She was not only taking a number of regular prescription medicines, she was taking handfuls of supplements every day. And yet she was unable to work. She had been unable to work for more than 10 years. She had missed an enormous chunk of her children's lives. She couldn't travel. She would become fatigued just having coffee with a friend. She couldn't walk more than a mile, and a mile was on a good day. She couldn't even visit her mother, who lived about an hour and 15 minutes away. And she wouldn't drive. Somebody else, another family member would drive her, but just visiting her mother and spending time with her mother and coming home, that would sometimes wipe her out for a week. All right. So she came to me because her oldest child had just started his senior year of high school. And it had been a plan for a long time that the whole family, after he graduated, would go on a big family vacation, traveling through France for 6 weeks at least. This woman's husband had been saving his vacation and had some sabbatical time that he was going to use, and the entire family was excited. And she was petrified. She was terrified because she got exhausted just going to see her mother just a little over an hour away. How was she going to manage a trip with a time change and not just, fall apart? She could barely walk a mile. How was she going to be able to go sightseeing with her family? Her diet was incredibly restrictive. She was very worried that she was not going to be able to find something she could eat, and she might end up sick and at worst in the hospital, and ruining her family's vacation. And she did not know what she was going to do. Now, we worked together, And it took a while. And this is a point I want to make here, is that the results that you have are not instantaneous. They're not instantaneous. It's not like you can start seeing me and stop taking all your medicines or get rid of your other doctors. There is a period of time while your body starts to reset itself. There's a period of time as you become free of those beliefs and stories and opinions that you've had, so that for a little while it feels like nothing was happening. And for her, that's exactly what happened. For about 6 weeks, 6 months, she said, I don't know if this is working. I don't know if this is working. Nothing's really changing, for a while. Nothing's really changing. And then after about 6 months, she said, I'm really less tired than I used to be. I think I could volunteer. And she started volunteering in her youngest child's school. Now, remember, she had been unable to work at all for 10 years. And she was an educated professional, master's degree and everything. And she had been unable to hold a job because of her illness. So this having a volunteer job in the school library a few times a week, that was a big deal. That was a big, big set progress. And she became stronger and stronger, and less tired, had more energy, able to walk more, able to travel more, able, locally, just locally, didn't get exhausted by going to the grocery store. Her brain fog lifted. She had fewer and fewer reactions to foods. When she strayed from her diet, she had fewer reactions, until finally the family went on the vacation. And she went on her vacation, and she was able to fully 100% participate in the entire vacation. She went everywhere the rest of her family wanted to go. She walked 5 miles a day. She ate pretty much anything. There were a few things she wanted to avoid, but it didn't limit her. It didn't limit her enjoyment at all. And she had an amazing time. And when she got back, she said, it's time. I'm going to get a job. And she got her resume out and applied for work, and was able to work for the first time, for paid work for the first time in 10 years. This is the power of changing your health set point. This is the power of getting rid of the stories and the opinions about your illness. Your body knows what to do. It knows how to take over. It knows how to have these extraordinary results that go beyond anything that medicine can offer you. So I hope this has answered your questions. Thank you for watching. I realize this is a little longer than I wanted it to be, but it's pretty thorough. And I cannot wait to talk with you. So